of Going All In, Get the Edge You Need to Succeed. My name is Dr. Erin McKinley, and I have another awesome spotlight session today with Courtney Fose, Program Director, and KayLee Warren, current intern for the University of Arkansas for Medical Sciences and the Central Arkansas Veteran Healthcare System Dietetic Internship based in Little Rock, Arkansas. Welcome.
Thank you so much.
All right, before we get into talking a little bit about your program, tell us a little bit about you, Courtney, your journey to becoming a registered dietitian and how you landed as program director.
Okay. I started out here in Arkansas at the University of Central Arkansas for my undergraduate degree and wanted to get out of the state, and spread my wings some when it was time to apply for the internship. And so I only applied to out-of-state schools, and I ended up getting matched at Southeast Missouri State University, which is in Cape Girardeau, Missouri, and had a really great experience at that internship and had a mentor and role model in the ICU there that I just really kind of idolized. And she was a CNSC, Certified Nutrition Support Clinician. And, she wrote TPN and she worked, really hand in hand with the ICU physicians, and I wanted to be just like her. And so, so after getting a job in clinical back in Arkansas, I started working on becoming a CNSC and managing TPN orders. So my specialty is in nutrition support. And so in addition to nutrition support, my favorite thing about working was working with students. And I always found that I really looked forward to the days that I would get to precept. And so I became associated with the program more and more, got on the selection committee for several years, was on the advisory board for the program. And so, just really learned a lot about our program. And then, the position became available about 2 years ago, and I applied and got it. And so I've been the program director for right at about 2 years.
All right. And KayLee, where did you do your undergrad before landing at Arkansas?
So I went to Harding University. I actually graduated in 2018. And then I kind of moved around. I moved back home to Indiana and worked in the hospital for a year. I just kind of wanted to get some experience and figure out exactly what I wanted to do. And then after that, I moved to Florida and was just getting more clinical experience, still just trying to figure out what I wanted to do long term. And then I decided to apply for the internship. Uams was one of the internships that we talked a lot about at Harding, so I was very familiar with it. And a lot of my colleagues had gone through the internship. So I was able to kind of bounce ideas off of them and stuff.
Awesome. All right, Courtney, tell us all about the program.
Okay, so I am fortunate enough to be the program director for probably the longest name program of all Ascend accredited dietetic internships. We are the University of Arkansas for Medical Sciences and the Central Arkansas Veterans Healthcare System Dietetic Internship Program. We are located in Little Rock, Arkansas. And just wanted to show you a little bit about our city. With a lot of out-of-state applicants do apply to our program. Little Rock is the capital of Arkansas. We're located on the Arkansas River, and our nickname is the Natural State. This is a state that has pretty mild temperatures. Winter is a great time to be here. We have many temperate days, suitable for outdoor activities. So it's just a little glimpse of Little Rock. And our dietetic internship is jointly sponsored by two large and complex healthcare systems, the UAMS and CAVHS. And both systems are committed to excellence in education, service, patient care, and research. So you have twice the support when you're a student within our dietetic internship. And as you can see down here at the bottom, our program concentration is dual as well. It's a MNT and Management Dietetics Practice concentration. So a little history of our program. We were established in 1970 and became fully accredited in 72. Last year, 2019, we had a site visit with Ascend and submitted a self-study and had the accreditation recertification process. And we were given renewed accreditation, and that will last until 2028. And our mission of our internship is to meet the needs of the entry-level registered dietitian nutritionist in Arkansas and in VA healthcare systems serving the nation's veterans. So I'll talk a little bit about CAVHS. So you may have seen, something online or, spoken with another VA program director for an internship, and you may not see the Little Rock program listed quite at the top of the list of the VA programs. And that is because we're this jointly sponsored program. So we're a little bit different from the others, but there are a lot of similarities as well. So we are absolutely associated with the VA. So the Central Arkansas Veterans Healthcare System is composed of 2 hospitals. We have a North Little Rock facility, which covers mental health, long-term care, and rehab and outpatient services. And the Little Rock facility is for acute care and outpatient services. In addition, CAVHS reaches out to veterans through its 8 community-based outpatient clinics in the Central Arkansas area, as well as they've got some extensions all the way to the north and all the way to the south ends of our state as well. So CAVHS is widely recognized for excellence in education, research, and a tradition of quality in caring for Arkansas veterans. They have 37 registered dietitians that work for CAVHS, and I tried to, to get that real research of how many RDs are employed at our sites to tell you about, how many preceptors are available and what kind of support this program gets, from RDs at these sites. So now moving on to UAMS, we are Arkansas's only academic health system. Our program is housed in the Department of Dietetics and Nutrition within the College of Health Professions. And we also offer the colleges of nursing, medicine, pharmacy, public health, and the graduate school. And our academic programs are located on the same campus as the university hospital. And so this is us pictured here. This is our current class, and they've all got their face masks on. This was during our orientation week, which was a beautiful day, you can see. And so our hospital has 535 beds. We are the state's only level 1 trauma center for adult patients, and we employ 32 registered dietitians. So we've got a lot of RDs, a lot of great preceptors at UAMS. So I'll tell you a little bit about our program. It is 9 months. It runs August through May. It is 40 weeks long. Class day is Monday, so you get to spend Mondays with me every Monday, and I love getting to spend that time with the students. It's probably my favorite part of the week. And so you do enroll in graduate coursework. So it's a post-baccalaureate certificate program at this time. And so the courses you enroll in are advanced clinical dietetics, nutrition counseling, and nutrition seminar in the spring. And so you do get that 12 hours of graduate credit upon completion of the program. So supervised practice experiences are scheduled Tuesday through Friday, and they're usually about 32 hours a week. Most of your experiences will be within a traditional work week schedule. And following the internship, you have the option to enroll in the MSc and Masters of Science Clinical Nutrition program, which is 100% online. So if you get a new job as an RD after our internship and it takes you across the country, wherever you want to go, you can still transfer those 12 graduate credit hours into the MSCN program and complete it virtually. So we try to be very flexible for our students. And so this is the list of our practicum experiences for supervised practice. The experiences are split between the fall and spring semesters, with half of the interns enrolling in the administrative practicum in the fall semester and the other half in the clinical practicum. And in the spring, the groups rotate to complete the other supervised practice experiences. So each semester of rotations are 20 weeks each. And the rotations are supplemented with didactic coursework, including post-rotation exams to ensure that students are learning the necessary requirements to function as an entry-level RD upon completion of our program. So I believe that we have a very diverse range of experiences, and you really get to see many areas of dietetics. And so we're fortunate enough to have a lot of participating facilities here in Arkansas. For example, Arkansas Children's Hospital there, our students complete a 3-week pediatric rotation there, and that's one of the largest pediatric hospitals in the United States. The hospital includes 336 beds and offers 3 intensive care units, including the burn unit that treats both children and adults. So that's the other level 1 acute care hospital here in Arkansas, and so it's a pediatric option. And the campus spans 36 city blocks. It's very large, and they employ 39 registered dietitians. So it's a lot of great experiences that can be had in pediatrics, which is honestly very rare for dietetic internships. You won't find all that many that you can offer a 3-week pediatric experience. So I wanted to tell you guys a bit about our outcome measures. Since our program began, over 650 graduates have completed our program. And in the past 3 years, 100% of our interns completed the program and 95% passed the RD exam. And here are some photos of our 2020 graduates that graduated in May with their letters from CDR showing they passed the exam. And you may have noticed that this is a really fun social media trend that's going on right now, where folks hold that letter and, and say, I passed the RD exam today. And so it's really, really fun being in my position and getting to see these posts and these photos and, vicariously living through the excitement of these students who, I get very close with throughout the year. So it's so fun to get to see these. And so I wanted to share with you guys some more info about our admissions requirements. And so you can see that listed here. Now, in addition to this, something important to know is that on our website, our current enrollment profile is available. So if you're curious about, many people will say, what's the minimum score on the GRE that we can get? Well, we don't have a minimum score. But you can, we do use it in our selection process though. So it does count. And so if you want to know, do I have a GRE that's competitive or comparable to the students that are currently there, you can go to our website. And so I actually did jot down what it says. So the average overall GPA of, and this is actually for our students last year, was 3.45. And there's no minimum requirement for the GRE for admission to our program, but the average GRE verbal score was 149, and the average GRE quantitative score was 145, and the average writing score was 3.86. So that can kind of let you know, how competitive you are and if it's worth your time to, go back and take it again if you need to get a higher score to be truly competitive. So our program does not conduct interviews as part of our selection process. That's a question I get quite a bit. We do accept 14 interns during the spring match annually. And these are the items that our selection committee considers as part of, who we will accept and who can match to our program. So we do participate in DICAS and in the D&D computer match, and that is due February 15th. And in addition to that, we do have a supplemental application directly to the College of Health Professions at UAMS. And we've got the link there. There is a $40 non-refundable application fee associated with that. And we do require that your official GRE score report be sent directly from the company, which is ETS, to our institution, which is 6146. So if you take the GRE anytime between now and February 15th, you will be allowed to write down some institution codes at the time that it will automatically get sent to. And a little tidbit for you here is that there's no charge at that time to send it. Whereas if you ask later on for your score report to be sent to an institution, then there is an additional charge. So write down 6146 and take it in with you when you take the exam. So to tell you about our program cost and tuition, this is the current tuition prices for our enrolled students this year. For in-state students, tuition will be, under $5,000 for the whole program, and for out-of-state, around $10,000 for the whole program. And there are additional fees, of course, associated with the program. Purchasing books. We require all students to have health insurance. We charge a standardized patient fee, for working with the standardized patients in our nutrition counseling course. We do offer financial aid and have some scholarships available at Uams. And then ding, 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 we provide a stipend to all 14 of our match students. And so over the year, for our current students, it's about $8,200. And the amounts are a little bit different for each semester depending on which practicum you're in. So during the semester that you're associated with the VA, you'll get the VA stipend, and during the semester that you're in your clinical practicum, you'll get the UAMS stipend. And so those together adds up to this amount. So it is incredibly beneficial for our students to receive that stipend, and, can really be the difference between having to take out a student loan or not having to take out one, depending on your situation, or just having a little bit of that breath of relief, to have that financial assistance, considering all this work that you're doing over the year. So I think it's really financially wise to apply to our program. And so now I've got a slide here about KayLee, and just wanted her to talk a little bit about her experience in the program. So I'll turn it over to her.
Yeah, so I'll just kind of talk about how I picked the program. Like I said before, I did go to Harding, which is in Searcy, Arkansas. So I was familiar with the program already, and had a few friends that had completed the program. So I kind of knew what to expect. But I made a little list here of things that helped me decide. One was the time to complete the program. So it is only 9 months long, which for me, I had already been working full time before I started the program. So going without an income after having an income is really hard. And so going into the program, I had saved a bunch, but I also knew that I wasn't going to have a very big income for the next 9 months. So that was a big deal for it to be pretty short term. I knew that I could live off my savings for that time being. Second was the location. So I moved back to Indiana, and then I moved to Florida afterwards. But this area was a place that I was really comfortable with. I knew the area pretty well from living here for 4 years. So I knew that this was a place I wanted to settle down, and just saw it as a great opportunity to apply here, and hope that I got into the program. And then like Miss Fose said, the stipend was a huge thing for me. So that is really rare to find a program that actually pays you. And being out of state, it was going to cost me a little bit more than the in-state applicants. So having that stipend kind of offset those costs for me and made it really affordable for me to participate in this program. And then the last thing that really made me decide was the overall experience. So like I said, I had talked to some people about completing the program and basically just asked, did they feel like they were prepared to be a dietitian after they completed the program? And they all felt that they were adequately prepared. They felt like they were prepared for the exam. And so for me, that was really comforting to hear from other peers that they really felt like the program was worth it. And they felt like the professors and preceptors really made sure that they were prepared for that exam and prepared to begin their career. So yeah, those were the biggest things that made me decide. And then I did apply for a few programs, but this was the one that I was definitely hoping to get into for those reasons.
All right, well, I will jump back in here. And so this slide here, I put my contact information in case anybody wants to shoot me an email or give me a call, ask any questions. I'm happy to chat more about the program. And then our last slide here that I thought I would leave you with is this is a hiker on Pinnacle Mountain, which is a short 16-mile drive from our campus. It's located right here in Little Rock, and I hope that you can see yourself here and envision yourself in Little Rock and, being an intern with us. So that is the end of my slideshow.
All right. Thank you so much for that. So I'm going to dive right into the 5 questions that I ask every director that comes on the podcast. And these questions were put together with the help of my students, just kind of collaborated on what are the things that they really want to know from a director about applying to their program. So the first question is, what is one thing in particular that you just love to see when you're reading a personal statement?
Well, KayLee is a great example of this. I really love to see that this person has experience in dietetics and that I can feel confident that they know what they're getting into. My worst fear with accepting an applicant is that they will get into this program and they may walk into a hospital and say, oh no, I've made a huge mistake. This is not what I want to do. So I want an applicant to demonstrate that they've, researched this profession, perhaps they've volunteered with an RD or, had an actual job, but in some way can say, this is, I'm certain this is what I want.
All right. So the second question is a true or false question. So true or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
Okay. So for me, I'm going to go true. And the reason for that is we actually put on our website in our application requirements, a 1-page resume. Now we get people that will submit 2 pages and that's fine. We don't hold that against them. But, I tend to think that usually at this point in someone's career, 1 page can usually be enough. Now, if they, really need to go on and, move it on to 2 pages, then that's okay. But the advice I would give someone is to make it 1 page.
All right. So what is one thing that an applicant may do that kind of raises red flags for you to where maybe you'd say this person might not be the best fit for our program?
Okay. So kind of be the opposite of what I'm looking for in the personal statement, but but if it's someone that I can't tell that they've really had any experience in the program in dietetics. So, either a lack of work or volunteer experience, or, it doesn't look like they've, really done anything in our field. That's going to be something that will concern me.
Okay. Anything else? Any horror stories you want to share?
No, we've been very fortunate. I love our interns. We end up with a really great class every year.
All right. So what is one area of the program that you're actively working on trying to make even better for the interns?
So we have found every 5 years the RD exam is updated. And so it was last updated in 2017. And so, we are hearing and noticing that the test is becoming much more application based, so application of critical thinking skills. It's no longer, perhaps it maybe was at one time, a demonstration of your memory of, dietetics concepts and, terminology and ability to do, a food service calculation. So in light of that, we've been really focusing on incorporating those application-based questions into our exams, because you are in these 12 hours of graduate coursework. So there's plenty of exams and quizzes and assignments. And so we've really been trying to, use these 9 months to train someone to be able to think critically during an exam and work through these application-based questions, and, to make sure that when they leave our program, they're prepared.
Do you happen to put them through one of those official exam review courses that's offered, kind of the pricey ones towards the end of the internship?
We do our own, not to say, I recommend that they perhaps do another program in addition to that, if that will give them, more confidence, which, really kind of does a lot when you take the exam. But we do our own RD exam review throughout the spring semester. So our program ends in May. We probably start around March, and we do, weekly 1-hour sessions. We do require all of our students to take a mock RD exam and get a certain score. So not to mention that, but I also do RD exam questions every Monday throughout the whole program. We call them RD exam jams. And so after they take them and they attempt to answer them, we will, as a group, kind of talk through, how did we get to this answer? And, just trying to kind of turn on those wheels.
Keep them turning. That's the big thing. All right. So my last question is a two-parter. And the first part is, what are the 3 best adjectives or descriptors or phrases to describe your program as a whole?
Okay. I would say that it is fast-paced and supportive. Our faculty and our preceptors care a great deal about the success of our interns. And so I think that's probably one of the areas that we get our highest marks on, in like exit surveys from our students, is that they feel really cared for and supported. And then let me think. I guess I would say variety, that we have a real variety of rotations and experiences.
All right. So
fast.
So the second part of this question, very similar, 3 adjectives or descriptors to describe your ideal applicant.
Okay. I would say someone who is very organized is a real goal for the ideal applicant. And, but also someone who's flexible, so able to stay on top of the schedule, but able to make adjustments if that's necessary, especially in the year 2020. And so I guess for the third, I'd say open-minded. Sometimes you may be assigned to a rotation. You walk into this program and you may think, I will never work in, this particular area of dietetics. But be open-minded, because after you get in there, you may, love it. People will really get their mind changed sometimes if you can be, flexible and open-minded.
So kind of following up on one thing you mentioned with all the things that had to happen this year, what are some of the things that you had to do on the fly to make sure that interns were still getting their experience, and how have you kind of kept some of those things going into the fall?
Yeah, so, like everybody, March was crazy. It was just very complicated, but we're very fortunate because our students, our program's from August through May. And so we didn't get a case of COVID in Arkansas until about March 13th, maybe. And maybe 1 or 2 days later, Uams pulled all their students out of rotations, because they've got a lot of different kinds of students. And I think that the thought was that there was not a current plan. There weren't policies in place, for this kind of event. And so I think they just thought, let's get a plan made, and then bring students back in. So from August to March, our students had gotten over 1,000 hours of supervised practice. And so shortly after COVID hit, Ascend alerted program directors that you could reduce the number of actual supervised practice hours from 1,200 to 1,000 in light of COVID. And so at that moment, we made the decision that we would move everything virtual from that point forward. That the risk really didn't, the benefit really didn't outweigh the risk, at that time. They had the hours they needed. And so we just really focused on RD exam preparation, and then also moved a lot of our rotations online. And so we had fabulous preceptor support, who would Zoom with students and, hold up tube feeding kits and, EN fit connectors, and explain things, that you would have gotten to see, in person. Spring is when we do our nutrition counseling course. And so we use the clinical skills lab here on campus, working with standardized patients, which are real people and they're actors. It's very fun. And they have specific patient profiles that they learn and memorize, and they're kind of acting out this part the whole time. So our students had gotten one experience in the clinical skills lab when everybody got sent home. And so we moved all those experiences online. And so, that's when we learned a lot about Zoom and, got the actors' accounts at home to use. And, one of the patients is a husband and wife. And so luckily, we had a husband and wife that were already living together and, in each other's bubble that were able to do it. So that was great because it allowed our students to participate in telehealth. And, honestly, that was something we probably should have been doing in our nutrition counseling course already. So we got such good feedback that will be a change that we make, that we will continue having a telehealth case in the nutrition counseling course going forward.
All right, awesome. So we have a question in the chat for KayLee. So what has been your favorite rotation site so far?
So right now I'm in my admin rotation. So it's a lot of food service, but I also have been able to go to those satellite clinics that Ms. Fose talked about. They're called CBOX, and that's through the VA. So basically in the more rural areas, they have these clinics that are set up so the veterans can go there instead of having to travel so far. And that was really fun for me. I really enjoyed that. Those dietitians get to play a really cool role where they kind of get to do everything. So they get to do a lot of diabetes education. There's a program through the VA called MOVE, and it's for weight management. So they get to work with patients on weight management, which in Arkansas is a pretty big deal. So they definitely see a lot of those patients, and that's really cool to kind of get to do a little bit of everything. And so I've really enjoyed that one, as well as diabetes education. That is kind of where I see myself long term. So I haven't gotten to do a lot of clinical experience yet, but I've kind of gotten to dabble in that a little bit and kind of see what my role would be in that. So those are both ones that I really enjoyed.
All right. Do we have any other questions from the students that are with us today?
I have a question. So what is the most important thing that you look at in your applicants? I know you talked about experience. Would you say that is the biggest factor, or GPA, recommendation letters?
I can tell you that recommendation letters is probably the least, if that helps you.
Okay.
I mean, GRE, GPA, work volunteer experience, and like extracurriculars, those are all kind of weighted the same, I would say. But yeah, reference letters is probably the lowest. Still important, but just, not ranked
Less
quite high for us. Yeah.
Thank you.
Any other questions from the students that are with us? All right, I'm going to ask KayLee another question. So I'm just curious, did you take the DTR exam in that time in between, or did you just jump right into work knowing that the work experience was going to be important when applying later?
Yeah, so I did not take the exam. I actually worked in the hospital as a patient care tech. So I was able to work in a travel position, which was pretty unique. So basically wherever they were short staffed, I would get sent. So I got a lot of experience in the ICU, as well as like cardiac and other things. And so I did get some experience through that because a lot of times the patient care techs are recording intake and other things like that. So at the time, I was kind of just getting feelers out. I had looked into the internship, but I wasn't really sure if that's where I wanted to end up. So I was like, well, the best thing I can do, I know I want to do something medical. So I went pretty vague and got that experience as a patient care tech.
So pretty much doing the same thing you would be doing if you were a DTR. We have a lot of students that are so nervous about this process that they think that extra year is going to help them boost their confidence. But I think unbeknownst to them, it's really getting in there and working. Like, yes, the DTR exam is an option and it's a decent option and it's still a credential, but it's really getting out there and getting the hands-on experience to talk about later that sometimes can overcome some blips, as I call them, if it's a GPA issue or whatever it was that was the issue while they were still a student. So I'm glad that you were with us today and able to kind of express that experience of how to use that time wisely and how it's paid off for you. So thank you so much. So do we have any other questions for Courtney or KayLee today?
I just have one more question. Is there an open house coming up?
Yes, we have a virtual information session on Thursday, actually. And I believe I provided the flyer to Dr. McKinley, so I think she can, I don't know, are you emailing that to everybody?
It's in the seniors Google Drive.
Okay, thank you.
Great.
The magical Google Drive.
Yes.
The secret seniors only Google Drive that LSU students have access to. All right. Well, I don't think we have any more questions. So, Courtney, give us one last take-home message for potential applicants this spring.
Well, I think the thing that really sets our program apart, from the student perspective is the stipend. So just, if you're crunching the numbers, trying to figure out, what's it going to cost for an apartment? What's it going to cost for this? Just, keep in mind that we do have that support available for students, and it is pretty rare. So I just hope that you will apply to our program and hopefully get that stipend for all 14.
And KayLee, what do you have? One last message for potential applicants from your point of view?
I would just encourage all the applicants to really consider this program. Not just speaking for myself, but from other people. The staff at UAMS is amazing, and the VA as well. They really are there to support you. So even if you're nervous about succeeding in the program, they're always going to be there to make sure that you succeed. There's always resources for you to reach out. And like Ms. Fose said, the stipend is great, and working for the VA, if you're not sure if maybe that's where you want to end up down the road, being an intern in the VA, you already are in the system and you get that experience. And so if you see yourself down the road wanting to work in one of those positions, you're going to be set apart from other applicants who don't have that. So I think that's really important to consider in the future.
Yes, that is great advice. All right. And for those at home who would like more information on the dietetic internship with the University of Arkansas for Medical Sciences and to reach out to Courtney, check out their link that I've provided to you in the description below this video. And as always, don't forget to like this video and subscribe to my page so you never miss a spotlight session with another awesome dietetic internship. And we'll see you next time.
Thank you.
Thank you.